Okay, we're here with Shelby May, and she's the program director of CNA, right?
Yes.
Okay, if somebody doesn't know, what's CNA stand for?
So CNA stands for Certified Nursing Assistant.
Okay, what is a nursing assistant? Once again, if somebody doesn't know.
A CNA works alongside mainly the nurse, but other allied health professionals doing direct patient care. So the CNA would be the one to assist the patient to get dressed in the morning, to bathe, to eat if they need assistance with eating, to brush their teeth and those types of things to help them get out of bed and to walk down the halls and so forth. So really direct patient care.
Okay, and would we see these in hospitals or other places besides hospitals?
We would see them in hospitals, in long-term care facilities, in rehab facilities as well. So CNAs work in a lot of different healthcare facilities.
Okay, and in the program at Parkland, what kind of commitment are we looking at? Is it a 2-year program or?
It's actually just one semester. So it's just one semester, 16 weeks, and it's a pretty full 16 weeks. The student is in theory for that, but we also are in lab. We do lab skills. Where the student learns a lab skill and practices it, and then we go to clinical after that, where the student actually works with patients and practices those lab skills with patients.
Okay, and what kind of students kind of excel at this?
Well, students that really are kind of self-motivated, independent, but they also have to be kind of caring and compassionate. They have to have that kind of spirit as well, where they're putting the patient's needs before their own. And one also, we see a lot of students who want to go into nursing or maybe even other fields like physical therapy or other therapies. So this is a lot of times seen as a stepping stone to other healthcare careers as well.
Okay, and what we always ask, what kind of pay scale are we looking at for these people when they first start?
The range is typically around 11 to 12 to start, but it can go up to around 16 to 17 per hour.
Okay, and let's talk a little more. You said like this to start, but then this may be where a lot of people start. This is a good way to get your foot in the door, I'm guessing, and then maybe take some classes on the side, or how do people usually do that?
Yeah, so if they want to go into another health career, a lot of times they start with the CNA. For example, we have sections of high school students who are looking at nursing, for example, or other healthcare fields as a career. So they get their CNA in high school and they can work as a CNA and get some experience in healthcare, and then they can really know if that's what they want to do as a career. And oftentimes those students do go into other health careers.
I would think too, we talked about what makes you good at certain things, but I guess every situation, every day is probably different. What is a typical day like for a CNA?
So a typical day would be you get your patient list, so you work with different types of patients or residents, and they all have varying abilities. So you might have a patient or a resident who you need to do everything with, so that patient really can't do anything themselves, so you would be completely responsible for their care. But there are other patients who can be very independent, and so they just need a little bit of assistance with their activities of daily living, so that you might just assist that patient a little bit. But you would help them with their morning care, maybe help get them to their meals, help them to ambulate and their mobility skills as well, and work alongside nurses and therapists to take care of those patients' needs.
That sounds great, and I know Parkland has a really good rate of job placement.
Yes.
I assume this program's probably about the same?
Yes, there's always a need for CNAs, and that's really the great thing about it. You can go here in the community and get a job very quickly as a CNA, but you can also go out anywhere you want to go and work as a CNA, because there's just always a need for CNAs, so it's a great field.
Do they have to take any kind of licensing tests or anything like that, or?
Yes, a state exam is required, and so once they're done with the program, they sit for their state exam, and once they're certified, then they don't have to take another exam. But if they go out of state, they might have to sit for another state's state exam as well.
Okay, and last question. I'm sure you're out in the community a lot, and you see students you used to have.
Yeah.
What's it like when you see these students and you know they're doing well, and to know that you had a part in that?
Oh, I think it's great. You know, I see students. I was in clinical just last week, and I saw 2 students that were my CNA students that are now RNs, and they've been working in the field for a few years now, and so that's wonderful to see. That's what we love to see, students being successful, doing what they love. So it's a great feeling.